All right, so good afternoon, everyone. Um, Thank you for logging in today. As you may have seen in the email, I was in a car accident on Saturday. I am slowly healing from it, so I am doing this class from my family's home in San Antonio while I heal. And my parents happen to have, well, two dogs and a cat, as you can kind of see there. So if you hear any barking or anything in the background, that's what you're hearing is some of the family pets. So we're going to wrap up chapter 17 today. As we go along, if you have questions, you can type them into the chat box, or you can use the hand raising icon at the bottom of your screen. So we talked last time about education and welfare. Today we're going to talk about healthcare, um, issues with poverty, and problems that we see with the social policies of the United States. So again, as we're going along, if you have questions or comments, you can type them into the chat box, or you can use the hand raising icon. Okay, in terms of healthcare, there are two main national health institutes. The first is called the National Institutes of Health, or the NIH. They are responsible for doing some of the biomedical research. So it was created in 1937 to come up with new medications. Things like insulin for diabetics, heart medication, asthma inhalers, and things like that are done by the NIH. They're the ones currently investing in the development of vaccines for COVID-19. They've got about $32 billion in expenditures. They've done a lot of very critical research. They were the ones who linked cigarette smoking to cancer, helped us to understand how bad cigarettes actually are for our health. So it's because of their work in the 60s that we have the warnings on the cigarette packages that they are incredibly bad for our health. They are also involved in HIV/AIDS research. They spend about 33 million a year, give or take. Some of the research they're doing is on things like new medication, testing, but also keeping track of outbreaks. Because heroin use is on the rise, and heroin is usually injected intravenously with a needle, we do unfortunately see addicts sometimes sharing needles, which means there's a higher risk of HIV/AIDS in communities with high drug use. So they're trying to help with that as well. There's also the Centers for Disease Control, or the CDC as they're known, that monitors the outbreak of diseases, tries to implement preventative measures, and coordinates public health measures. So obviously right now with the pandemic, they're focused on COVID. Usually they're focused on things like flu season and outbreaks of diseases like whooping cough or the measles. So right now they're focused on tracking cases, including what's called a super spreader event, keeping track of death rates, increases in various states, and so on. So they do a lot of the important medical healthcare, and also just kind of keeping an eye on things. Okay, with Medicaid, federal grants to the states for Medicaid cost about $392 billion every single year. And 65% of Medicaid spending actually goes to the elderly and the disabled, not necessarily to people in poverty. The reason for this is that Medicaid becomes the de facto funding source for senior citizens who don't have any savings left when they're living in an assisted care facility or a nursing home. So if they have to move into an assisted care facility, but they run out of money, eventually Medicaid can help cover the difference. So Medicaid currently covers about 72 million Americans, and again, the majority of them are the elderly and the disabled. Okay, any questions? Okay. So in terms of health care reform, the reality is that most employers don't offer health insurance to their employees. Now, for small businesses, this makes sense. They can't afford to provide health care because it's too expensive. For bigger companies, unless you're working full-time permanent, more often than not, you are not entitled to health insurance. So only 55% of the non-elderly get their health care through their employer. So that means most people either have to get private insurance or go without. So the elderly tend to get their health care covered through Medicare, and the poor and disabled get their health care covered through Medicaid. But it's obviously a problem that 45% of the non-elderly don't have access to health care through their job. So President Clinton tried to tackle this problem in 1993 to create a universal health care plan. Now, universal health care is common throughout most of Europe. You basically pay taxes and the government provides health care rather than a private marketplace. So this is what Clinton wanted to do to deal with the rising cost of healthcare. Unfortunately, the healthcare companies did not support this idea, and there were Americans who worried about losing their healthcare, who said, my healthcare works for me, I don't want to have it taken away. So he was unable to make any real changes to the healthcare system. The next big attempt to fix healthcare was 2003, when Congress added a prescription drug benefit packet to Medicare. Unfortunately, they did not give the government the power to purchase drugs to reduce the prices. So it was largely toothless. It didn't do much to lower the cost of medications. And this is a real problem in this country, the amount of money you have to pay for prescription drugs. Life-saving drugs like insulin should be exceedingly cheap, but they're very expensive, partly because there's really no generic version of insulin. So some diabetics are forced to pay $500, $600 a month for their insulin, which leads to some diabetics rationing their insulin to try and make ends meet, which unfortunately then leads to them becoming sick or dying. There's also issues with the costs of medications like the EpiPen, which have also skyrocketed. So our prescription drugs are very expensive, and it's a problem for a lot of Americans. We do tend to find senior citizens going to Canada or Mexico because the drug prices are cheaper. It's partly why we get so many winter Texans here, because we're so close to the border. They come to the valley and take advantage of the cheaper costs for doctors, dentists, and so on, and the cheaper prescription prices in Mexico. So we haven't really tackled the problem of high prescription drug costs, although that's a problem we're going to need to look at. All right, so the next big fix in healthcare came through the Affordable Care Act, or Obamacare as it's also commonly known. The Affordable Care Act was passed in 2010 to try and help provide health insurance to millions of Americans. So here's how it largely works. Basically, every state was required to create an insurance exchange market. So here in Texas, basically, you would get a subsidy on your health insurance, kind of like a tax break. So you would put in the amount of money you make per month, roughly. And then you would get information saying, okay, this healthcare plan is usually $300 a month, but you only have to pay $150 because of the subsidies. So the idea was basically to provide tax subsidies to help people pay for healthcare coverage. Now, the biggest thing the Affordable Care Act did was it stopped allowing insurance companies to deny coverage based on pre-existing conditions. Insurance companies had a policy of refusing to give coverage or increasing the premiums for someone with diabetes, a cancer survivor, someone with heart or lung problems. And my personal favorite, charging women more for healthcare because, according to the insurance companies, pregnancy is a pre-existing condition in women, like we're all born pregnant or something. So getting rid of the ability for companies to charge more or deny coverage because of pre-existing conditions did help Americans get health insurance. By the way, this is something pretty unique to the United States. Most other countries don't call it pre-existing conditions, they just call it your medical history. Now, the downside to this plan was it did require individuals to have health insurance or face a tax penalty of 1% of their yearly income or $95, whatever was greater. Luckily, that provision has been removed. There were people who made just enough money to where they didn't qualify for Medicaid, but not enough to buy insurance. So removing this tax penalty actually was beneficial. Another thing that helped was allowing children to stay on their parents' health insurance until they turned 26. This was especially important because when the economy went into a recession, a lot of young people graduating college could only find part-time work. So they didn't have the ability to get health insurance. So this gave them the ability to take whatever job they could and still have health insurance. So it covered more young people, which was a huge, huge help. There is also the expansion of the Medicaid program. It's now available for working age adults without dependent children and anyone making up to $27,724 a year. The ACA is not perfect. There are many flaws in this system, but it has given people health care. It has leveled the playing field for some people who would not have access to health insurance otherwise. So it's not perfect, but it was a start in the right direction. Okay, so the Affordable Care Act was passed through very partisan means. Basically, all Democrats voted in favor of it, all Republicans against it. So when Republicans took back control of Congress, they voted 62 times by 2016 to repeal the Affordable Care Act, and every time they failed. Partly because people were not happy with the idea of being dumped back onto the healthcare market. Also, they were getting pressure from their constituents saying, I actually like this. Don't take away my health care. So they have not yet repealed the Affordable Care Act. They have tried multiple times, but they have not succeeded. And it wasn't an easy process to get the ACA up and running. Healthcare.gov, they kept running into problems getting the website out, and then when it was available, millions of people were trying to log on, so the application kept crashing. You'd get about halfway through the application and the website would just crash. So it took a while to get the website completely rolled out and working. And once they finally got it to work, by April of 2014, 8 million Americans had already applied for coverage under the Affordable Care Act. So millions of Americans are now covered by this act. And it is based on your income. So if you're making absolutely no money, you're not going to be charged a lot for health care. So the idea is to at least make it a little easier to get coverage. Now, the Affordable Care Act was challenged by Republicans, and the Supreme Court said it was constitutional because it falls under congressional powers of taxation. However, the federal government also tried to say that states had to expand Medicaid coverage or they would lose their existing Medicaid funding. So the Supreme Court said you cannot do that. You cannot force them to expand Medicaid. So the states that opted out of expanding Medicaid saw about 3 million people left without access to health insurance. So unfortunately, the striking down of this provision hurt a lot of poor individuals. There was also a lot of controversy over the contraception coverage. The Affordable Care Act required employers to provide contraception coverage for women at no cost. So prior to the Affordable Care Act, women would sometimes have to pay anywhere between $50 to $100 a month for contraception shots, pills, patches, etc. So the idea was to make contraception coverage available and to make it easier for women to have access to contraception. Now, for some women, of course, contraception is necessary for health reasons. Sometimes women have very painful periods, ovarian cysts, various disorders that require them to be on contraception. But there were religiously owned organizations, especially conservative Christian organizations, that did not want to provide contraception coverage. So Hobby Lobby sued the government, saying that providing contraception coverage violated the owner's religious beliefs. So the Supreme Court said a closely held corporation, which is one in which the owners actively managed a company, that company is allowed to refuse to provide contraception coverage if it violates the owner's religious beliefs. So women who work for companies like Hobby Lobby or Chick-fil-A or work for colleges like Wheaton do not have contraception coverage. So they either have to pay out of pocket or apply for a supplemental insurance plan to cover contraception. Now, of course, this was controversial because you had people saying, well, what about the religious rights of the workers? Or what about the fact that for some women this is medically necessary? But basically, the court has said if the owner has an objection, they do not have to provide contraception coverage. Any questions before we move on? Okie dokie. Okay, so now we're going to switch over to housing. Housing is another big area of social policy. And it used to be the case that a lot of Americans were living in overcrowded housing. So think of a family of 6 living in a one-bedroom apartment. Also, people living in housing without electricity, running water, heat, etc. So the federal government introduced a housing voucher system to help poor Americans afford the rent. So when people talk about Section 8 housing, this is what they're talking about, federal assistance for rent. So the percentage of Americans in overcrowded housing dropped from 20% in 1940 to 9% by 1970. So it did help reduce overcrowding and get people into housing that at least had the basics, electricity, running water, etc. The problem with public housing was, one, it was racially segregated. Two, they weren't building them in the cities, which didn't help poor people who didn't have a car. They didn't have access to public transportation to go to work, grocery shopping, etc. They did fix some of that by the creation of high-rise public housing in cities like New York, Chicago, and Boston. But there's too much need and not enough money. It can be a very long wait for public housing. On average, it's about a 5 to 10-year waiting list. And vouchers don't necessarily cover enough of the costs of housing to get people into adequate housing. So we still have a lot of people who are not living in good, reliable housing. And in the 1990s, in what was a very well-meaning move, the Housing and Urban Development Department allowed cities to destroy the high-rise public housing and create mixed-income public housing, where you'd have a person in one apartment who needed housing assistance next to someone who didn't. Of course, this was a problem because what ended up happening was landlords started only renting to people who could afford the rent without needing assistance. So it caused even more problems with access to public housing. And then we saw an even bigger crisis in the 2008 collapse of the economy. Mortgage companies and banks had been deregulated to the point where they were allowed to offer low-cost loans with high interest rates that borrowers couldn't necessarily afford. So they'd offer someone a mortgage on a $300,000 house when they could realistically only afford a house that was about $150,000. So when the payments went up, the foreclosures also went up. So over 5 million homes were lost to foreclosure during this time period. And eventually the banks had to pay $26 billion to homeowners they improperly foreclosed on. They weren't giving them enough writing, enough notice, and they were auto-signing documents that should have been reviewed by a human. There was a particularly egregious case where a woman, the bank mistakenly said she was not paying her mortgage, and rather than talking to her about it, they foreclosed on her house. She left her house and she came back later to find the bank had changed the locks on her door, and in the process of foreclosing on the house, they managed to kill her pet parrot. Obviously, you do not want that happening. Even if you're going to foreclose on someone, you can't just lock them out of their house. So it became clear pretty quickly that the banks and mortgage companies had really screwed over people in terms of housing. So we had a lot of people who needed rent assistance, the homelessness rate went up, and a lot of homes just ended up sitting empty for several years because people just weren't buying houses. All right, so let's talk about how social policy affects different groups. For the elderly, Social Security, Medicare, and Medicaid have cut the poverty rate to about 10%. They now at least have a basic income. They can at least survive. So this has been a huge improvement for senior citizens. Unfortunately, the poverty rate for minority senior citizens is much higher than white senior citizens. For African Americans and Latinos over the age of 65, 18% of them are living in poverty. For white senior citizens, that's a little under 8%. A lot of that is tied to the type of work they were allowed to do. When minorities weren't allowed to work in certain jobs, they had to take low-paying jobs as skilled labor, housekeepers, and so on. So they made less money over their lifetime compared to white Americans. So that's partly why the poverty rate is so high, because they just didn't make as much money compared to white senior citizens. So the median income for senior citizens is a little under $37,000. Now, in the Valley, that will go pretty far. You can survive on that pretty reasonably. But in bigger cities, it does often force senior citizens to also apply for things like SNAP, or to work a part-time job to supplement their Social Security income. So they're not exactly, living a very fancy lifestyle, but it's generally enough to help them get by. And because Social Security and Medicare are entitlement programs, everyone who reaches 65 and a half is entitled to Social Security and Medicare, regardless of income or need. Now, obviously, wealthy senior citizens are not going to claim Social Security or Medicare, but the minute you become eligible, you are eligible no matter what. Doesn't matter how much money you made or if you need it, it's there. So this means that senior citizens are a very influential voting bloc. They do not like it when politicians talk about reforming Social Security or Medicare. Any politician that even tries to hint at that is going to themselves out of office. So they have to be very careful with what they say, because senior citizens do show up to vote, and you do not want to make them angry during an election. So they are, quite honestly, probably one of the most influential voting blocs, besides the relatively wealthy. Okay, so in terms of income, for the middle class, the benefits for senior citizens, Medicaid, Medicare, and Social Security have relieved them of quite a bit of the financial burden of caring for the elderly. You no longer have to have your parents living at home with you while you're also raising children. You no longer have to pay for their assisted care facility out of pocket. So the fact that more senior citizens can live alone does help the middle class in terms of not having to spend as much money for caring for their elderly parents. There's also some tax expenditures that can help the middle and upper classes. Employers and employees get a subsidy on health care. Also, homeowners can deduct the amount paid in interest on the mortgage from the income they report on their tax return. Same thing with student loan debt. When I file my taxes every year and I put in the amount of interest that I paid, it gets deducted from my income to show that my income is a little bit less because of the costs of student loans. So it's a way of helping them to have a little bit more money at the end of the year. Also, parents, of course, get to claim their children as dependents, so there are tax breaks for things like childcare, healthcare, and so on. So tax expenditures cost the U.S. Treasury $1.26 trillion every single year. That number goes up even higher when we cut taxes for the wealthy. Nobody likes paying taxes. That's just a fact of life. But if you cut taxes on the highest income levels, then the national debt goes up significantly. Tax cuts are expensive, especially if you give them to the people who, quite frankly, don't necessarily need them. Because again, they're not going to spend the money. So it's not going to stimulate the economy, and it's just going to drive up the debt. So ideally, yes, we would all like to have our taxes cut, but the budget can't afford to sustain them indefinitely. At some point, taxes have to go back up because it's just too expensive to maintain tax cuts. Okay, any questions? Apologies for the background noise. There's a dog sitting right next to me who just decided to flop onto his belly and grunt like a little piggy. So if any of you are pet owners, you know what that sounds like. Okay. For poor Americans, they don't necessarily benefit as much from social policies. The earned income tax credit does help, but the reality is that minimum wage has not kept up with inflation. We have not raised the minimum wage in more than a decade. It's sitting at $7.25 an hour when economists say it should be sitting somewhere around $10 an hour. The minimum wage is not enough to survive on anymore. There is nowhere in the United States where a person making the minimum wage can afford a two-bedroom apartment. So the number of people living in poverty has increased because the minimum wage is not keeping up with the higher costs of living. Until we raise the minimum wage, we're still going to have a problem with people living in poverty. Now, there are some benefits, of course. SNAP can provide a family of three, on average, $382 a month. Now, that's pretty good, right? You could feed your family on that. Now, keep in mind that $382 a month is the national average. It's taking into consideration the more generous benefits provided by states like California and Minnesota, whereas here in Texas, they would not be getting probably close to that. They might get closer to $200 a month. So that average is the national average. In some states, it's going to be significantly less than that. There's also the fact that the refusal of states to expand Medicaid has disproportionately impacted minorities. 27% of Hispanics and 16% of African Americans lack access to health care because the states did not expand Medicaid. Texas was one of those states. We've got a lot of Texans who do not have access to health insurance because Texas did not choose to expand Medicaid. Now, there is, of course, welfare available for adults caring for dependent children. Um, and usually, if you're claiming one benefit, you're going to be claiming extra. They're probably going to need rental assistance, SNAP, and Medicaid. Um, the problem that we face, though, is that there's just not enough organization of poor or welfare recipients. Um, there's not as much time to organize, there's not as many resources, and there's still this idea that some welfare recipients are just not deserving of our support. There's still a lot of false information about people on um, SNAP or welfare as undeserving, lazy, etc. So there's not as much motivation to help the poor um, get out of poverty. There's just not as much support as we'd probably need to have. Okay, and last, we're going to touch on minorities, women, and children. Statistically speaking, more minorities live in poverty, and they do earn less compared to white Americans. In 2014, the poverty rate for African Americans was 26%. It was 23% for Latinos and 10% for whites. And again, part of that is tied to the type of work you're doing. If you're working in an office, you're probably going to make more money than someone working as a day laborer. So part of that is tied to work. Also, statistically speaking, single mothers are twice as likely to live in poverty than the average American. And again, part of that is tied to income. On average, American women earn about 78 cents for every dollar that a man makes. It's even less for minority women. So when you take into consideration that they earn less than men and that they have the added cost of childcare and so on, unfortunately, they are more likely to live in poverty. And there's also the fact that sometimes going to work is more expensive than staying home. When you add in transportation, childcare, insurance, and so on, sometimes women are left poorer at the end of the month than they would be if they just continued to claim benefits. Now, there have been some movements to try to fix that by allowing women to keep their welfare benefits while working, also giving more tax breaks for childcare, etc. But unfortunately, single mothers are more likely to be living in poverty compared to single fathers, and even more likely compared to a two-income household. In terms of child poverty, it's sitting at about 18.4%, and there are differences based on race. A little under 11% of white children live in poverty versus 25% of Latino children and 28% of African American children. And again, this is tied to their parents. Because minority parents earn less money, their children are more likely to be living in poverty compared to white children. So we know there are problems in our country with poverty, lack of health care, and so on. We agree there's a problem. We don't agree on what to do about it. We support spending on things like Social Security and Medicare. But then people will say things like, well, I don't want my tax money going to someone who won't work, or I don't want to pay for welfare. So it's hard to tackle the issue when people just don't want to spend the money. We also spend more on healthcare than any other advanced nation. but we also have the highest number of uninsured people of any advanced nation. So we're spending money, but we're not seeing results. To put it quite bluntly, our healthcare system is broken. It just does not work. But we're not going to be able to fix it until we agree on a solution. There has to be an agreement amongst Americans on how to tackle the problems. And until we agree to a solution, poverty, inequality, and lack of healthcare are going to continue to plague the United States. So we got to figure something out because this just is not sustainable. All right, any questions? Okay, so using either the chat function or the hand raising icon, how many of you actually have health insurance? Okay, Kylie, you do. Anyone else? Ivan, you do? Okay. Okay. Do either of you want to comment on that or share anything? Just, I mean, how you feel about having health care? Are you happy with your health care? Just generally kind of how you feel about it. If you don't feel comfortable, that's okay. No, yeah, that does make sense. Yeah, yeah, um, yeah, yeah. It is problematic, right? You're sitting in the waiting room and you're like, they got here after I did. Why do they get to go ahead of me? Yes, yeah, I do understand that. Yeah. Or sometimes how long it takes at the doctor's office. I mean, it can take forever, right? And it's just like you're sitting there looking at your watch, like, am I done here yet? How much longer? Yeah, that makes total sense. Okay. Anyone else want to share anything? Bless you, Donkey. Okay, that's fine. So there's no class on Thursday, obviously, because it's Thanksgiving. So don't try to log on or show up to class or anything. We get the day off. Next Tuesday, we will start talking about foreign policy. So read the first half of chapter 18. I will post the final exam here in Blackboard next week. It is the exact same format as the midterm. It is 4 short essay questions, a page and a half per question, and you'll have a week to complete the final. Are there any questions on the final? You got it. Okay, great. Thank you, guys. Okay, so like I said, no class on Thursday. Enjoy your Thanksgiving. Stay safe. Be careful out there. If you have any questions between now and Tuesday, you can email me or call or text my cell phone. Happy Thanksgiving, and